I work at Aryan Super Speciality Hospital and Bay Clinic at Borivali West. I would like to thank BabyChakra for giving me this opportunity to talk about this very important topic that's going on: hand, foot, and mouth disease in children. So, why are we talking about hand, foot, mouth disease today? Because it is so prevalent right now. It's usually seen in late summer and early monsoon. Now, why all of a sudden we have seen like an epidemic of HFMD? Because it's commonly seen in children. So, usually we see this disease between infants to 10 years of age. Does that mean we don't see that in adults? No, we can see it in adults as well. So, we all have to be careful about it. But because it is more common in children, the spread is very easy, and this is a very highly contagious disease. कंटेजियस मतलब एक दूसरे को इसको फैलना बहुत ही आसान है, इसलिए बच्चों में ये बहुत कॉमनली होता है। स्कूल गोइंग एज में हम बहुत ज्यादा देखते हैं, बिकॉज बच्चों को एक दूसरे से दूर रखना पॉसिबल नहीं होता। सो हाउ डज दिस डिजीज प्रोसीड? सो दिस डिजीज इज सेल्फ लिमिटिंग, मतलब सेल्फ रिजॉल्व हो जाता है खुद ब खुद। पर उसके साथ जो सिम्टम्स होते हैं, सिम्टोमैटिक ट्रीटमेंट इज वेरी इंपॉर्टेंट इन दिस। यूजुअली दिस डिजीज लास्ट फॉर 7 to 10 days, 1 से 1.5 हफ्ते तक ये होता है, फिर वो ठीक हो जाता है। ये डिजीज किससे होता है? सो एक वायरस, दिस इज अ वायरल डिजीज। इट्स कॉज्ड बाय अ वायरस नेम कॉक्सैकी वायरस और एंट्रोवायरस। So it's caused by a virus and it spreads from one person to another. So how is this transmitted? कि बच्चों की secretions, मतलब हमारे nasal secretions, oral secretions, इस secretions की वजह से एक दूसरे को हो सकता है। फीको ओरल रूट बोलते हैं, मतलब अगर हाथ से अच्छे से साफ ना करे, हैंड हाइजीन मेंटेन ना हो, उसकी वजह से एक दूसरे को फैल सकता है। वर्टिकल ट्रांसमिशन मतलब एक माँ से बच्चे को ट्रांसफर हो सकता है, और इसीलिए प्रेगनेंसी में हम बहुत केयरफुल रहना जरूरी होता है, बिकॉज इन सिवियर circumstances, so this is not to scare anybody, but if the treatment is not taken properly, spontaneous abortion भी हो सकता है इसमें। this is how the disease is spread amongst person to person. now एक बच्चे को HFMD है कि नहीं है हम कैसे बताएंगे? तो एक बच्चा नॉर्मली एचएफएमडी का जो रहता है, उसको फीवर मतलब बुखार, मलेज मतलब थकान, वॉमिटिंग, डायरिया, abdominal पेन, सो ये सब सिम्टम्स से बच्चा आ जाता है। और बच्चे को ये सब चीजों की वजह से बच्चा काफी इरिटेबल हो जाता है। फिर क्लासिक उसके उसमें रैशेस मिलते हैं, जैसे कि हम नाम बोलते हैं HFMD, हैंड फुट एंड माउथ डिजीज। दिस रैश इज पर्टिकुलरली सीन ऑन हैंड, फुट एंड माउथ। सो ऑन योर हैंड एंड फुट यू सी अ मैक्युलोपैपुलर रैश, जो एक लाल कलर की रैश आती है, जो हाथ और पैरों में होती है, जिसमें पानी भर के फोड़ियां आ जाती है, मतलब वेसिकल और ब्लिस्टर्स आर डेवलप, दैट्स व्हाई इट्स कॉल्ड ब्लिस्टर्स इन चिल्ड्रन। सो पानी भर के फोड़ी हो जाती है उसमें। मुंह में अल्सर्स होते हैं, माउथ अल्सर्स हो जाते हैं, इसीलिए सोर थ्रोट भी हो सकता है। अगर एक हमें छाला नॉर्मल एक स्मॉल अल्सर ऑल्सो माउथ में हो, तो हमें खाने में कितनी डिफिकल्टी हो जाती है, हम कितने इरिटेबल हो जाते हैं। सो इमेजिन दैट सेम थिंग हैपनिंग विद अ किड, where the kid can't express so much and the kid has an ulcer in the mouth, so उसका इनटेक कम हो जाता है, खाना ठीक से नहीं खा पाते हैं, और वो काफी इरिटेबल हो जाते हैं। Now, these are the common features with which a child may present to you with HFMD. So, when a patient goes to a doctor, the doctor sees the clinical picture, sees the rash. So, the rash is very typical for a doctor to diagnose, sees the rash, and can diagnose the patient as hand, foot, mouth disease. बट अगर कभी भी डॉक्टर को कोई भी डाउट हो, तो हम उसको पीसीआर टेस्टिंग कर सकते हैं। मतलब एक स्पेशल तरह का टेस्ट होता है जिससे हम वायरस को टेस्ट करके वी कैन कंफर्म वेदर इट इज हैंड फुट माउथ डिजीज और नॉट। नाउ व्हाट वी सी इज कि uh, एक डायग्नोज हो गया उसका। नाउ अभी कॉमनली हाउ डू वी ट्रीट दिस डिजीज? सो जनरल मेजर्स वी हैव टू टेक। जनरल मेजर्स लाइक हाइड्रेशन, खाना, एज आई सेड माउथ अल्सर्स होते हैं बच्चों को, So the doctor can prescribe you ointments which can help numb the area and help the kid to eat. खाने में हम usually उनको नॉन स्पाइसी फूड, avoid cold drinks or beverages, give them ice creams or milkshakes which are cold, give them ice cubes to suck on so that they feel a little cool inside, and you can even add creams before lunch and dinner so that they can eat their normal food. Now this is the general measure, so you have to take care of the hydration and the food intake. Next is we are talking about the rash, that is the hand foot mouth disease के rash जो hand और foot में है वो blisters cause करते हैं. It is actually what is happening is it's disrupting the barrier of the skin. So you are exposing the skin to different types of infection. So we have to be careful कि secondarily it should not get affected. Hence, we have to maintain the hand hygiene. Plus, we have to add a topical antibiotic cream for that so that it does not get secondarily infected. कभी कभी फीवर हो तो हम उनको ओरल एनाल्जेसिक, ओरल एंटीहिस्टामिनिक ये सभी प्रिस्क्राइब करते हैं, बट दैट डिपेंड्स ऑन योर डॉक्टर. नाउ यू टेल मी कि ओके हाँ अगर मुझे पता है तो शुड आई जस्ट diagnose my child and treat it? No. This session is so that you get an awareness about the disease, so that you are more aware, you can do your home remedies. But whenever you have a rash, it is not necessary कि हर rash hand foot mouth disease है. It can be something else like herpes and all also which might require antiviral. This disease does not require antiviral because the virus पे antiviral does not act. It's an RNA virus, it's not a DNA virus. So always go to your doctor. So sometimes it can get complicated also. It can affect your brain, it can affect your heart, it can affect your lungs. So you have to be careful about the warning signs. And as soon as you see warning signs, you have to go to the doctor. So now we'll take up some questions. So this is just a basic idea about hand foot mouth disease. Now I have some questions that I can take. So, my first question is, how can I manage the blisters in a hand foot mouth disease when they discharge fluid in my 7-year-old child? So, in a 7-year-old child, when you have blisters, make sure you explain the child about the hand hygiene because fecal-oral route is the most common route for it to transmit. So, hand hygiene is very important, and topical antibiotic creams will help for secondary infections. One more thing I like to add is that this disease causes blisters. But touchwood, it's a very nice thing that the healing that happens is without any scarring. So the patient or the baby will not have scars after the blisters have gone. All you have to do is take care of the current infection in the baby. How care and precaution should I take to prevent the spread of hand foot mouth disease in the family when my kid is suffering from it? As we said, it's a very highly contagious disease. So, isolation is the key factor. You have to isolate the kid. Make sure if there is some other kid in your family, you have to keep those kids away from each other because kids are more prone to develop hand foot mouth disease. So, the other kid will definitely develop hand foot mouth disease if you're not taking care. What aftercare should I take once my kid has recovered from hand foot mouth disease? So, aftercare is just hydration and food intake. And if you see any warning signs, you have to go to the doctor. Otherwise, the blisters will heal without any scars. So, no, you don't have to worry about that at all. My kids had blisters on his hand. How can I prevent the spread of the blisters on the skin in hand foot mouth disease to other parts of the body in my kid? So it's very difficult to do this because in a kid, you cannot tell them not to touch their other body parts. Try and explain them as much as possible. Make sure to wash their hands multiple times in a day, and that is it. You cannot prevent transmission in other body parts, but usually it affects hands and foot. Are there any danger signs in the disease that need emergency attention? So, as I said earlier, it can affect your brain, it can affect your lungs, it can affect your heart. So, in the brain, it causes something called acute flaccid paralysis. If your baby is very irritable, stops moving or something, if you see hard jerky movements, it can lead to paralysis. So be careful about that warning sign. If the baby is having any difficulty in breathing or anything, please take them to the doctor and always seek proper medical advice from a certified person. So I'll just check if I have some other questions over here. How long it takes for the blisters to go completely? It usually takes around 2 weeks. And I think I have covered the rest of the questions. Is there any other question that you would like me to take? So, this session, again, I'm repeating, is for awareness. Do not self diagnose and treat your disease. My kids had blister on his hand. I think I already took that question, Nana. Is there any other question that any child which has fever, which is uncontrollable, child is irritable, child is not able to breathe, please take them to the doctor immediately. These are the danger signs in the disease. It can cause meningitis, acute flaccid paralysis, pneumonia, carditis. Please be careful about that. Nana, any other questions that I can take? So, the takeaway message for me would be it's a very self resolving disease. So, not to panic about it. I'm a mother of a 1 month old child right now, and I know as parents, it's very difficult to not worry. But try to stay relaxed, try to keep them hydrated, give them proper food, and give them a lot of love. They'll be fine. Just make sure they're isolated so that we don't infect other kids, and keep smiling. Don't worry.